Hi, my name is Kristin Scofield. I'm a registered nurse and I have my Bachelor's of Science in Nursing. I've been in the aesthetic field since 1999 and I'm one of the cosmetic nurse injectors here at Plastic and Cosmetic Surgery Center of Texas. Today I'm going to answer a few questions about lip filler and facial fillers. The type of filler that I would recommend for injecting into the lips, a good product would be Juvederm Ultra XC and Volbella XC. They are both FDA approved hyaluronic acid fillers, which are natural components of our body, which create a very subtle and pout that typically patients are looking for. Can I remove the lip filler once the filler has been injected? And the answer is yes. Because the product is hyaluronic acid, there's an enzyme called hyaluronidase that can dissolve the filler if the desired effect is too much. The next question is, are there any risks to lip filler? And the answer is yes. With all injections, there is a risk of bruising, there's a risk of swelling, there's a risk of injecting into an artery or a vein, and it is all reversible if that happens in an artery or a vein. It's extremely rare, but again, it's good to know to go to a provider that can help you reverse it. Here at our practice, we take every precaution to minimize those risks. I tell my patients no aspirin or Advil, things that thin the blood 2 weeks prior. That includes omega fatty 3 acids, vitamin E, ginkgo, St. John's wort, and try to stay away from alcohol at least 24 hours after. So how does somebody find the right provider? I would recommend doing your research for the best person for yourself would be to have somebody that is qualified, licensed, uses FDA approved products such as the Volbella and the Juvederm. And another thing is it's also important to know what to do with an adverse event as well. So that would be a good question while you're interviewing your injector to see if there was a complication, can that person help you? Next question is, how long do the fillers typically last in the lips? Our fillers last about a year, and I have patients typically come back in after 6 months for a little touch-up, and that usually sets them for the next 6 months. Really just depends on how big of a pout they're looking for and their desired look. But it's typically every 6 months, but the filler does last a full year. The results after the filler are pretty instant. You'll have some initial swelling for about 3 or 4 days, and I always tell patients not to judge it for about 2 weeks after. That's when everything kind of settles down and the bruising's gone, but it's pretty instant. The next question is, can I exercise after getting lip filler? The answer is no. I typically like patients to not exercise for at least 24 hours after the injection. So another question is, what is the downtime with lip filler? And there's really not that much downtime. You do have about 3 or 4 days of swelling. If I have a little bruising, you can certainly go to activities if you would like. Just keep in mind you're going to be swollen. But ice and arnica and things like that kind of help keep the swelling down and keep your head up elevated while you sleep. That helps as well. But it's very minimal downtime. If you're interested in lip fillers or facial fillers, please give us a call here at Plastic and Cosmetic Surgery Center of Texas, located in Plano, Texas.